Hi, I'm Tamara Mitchell, and this is my Week 8 check-off.
I'm Quincy Banks, and I give her permission to record me.
Alrighty, before we get this video started, we'll do a scan of the room so you see that there are no scripts present. Alrighty, we'll get this video started.
Come in.
I'm performing hand hygiene, put on my gloves, and providing my patient with privacy. Hello, Mr. Banks, how are you today?
Good, how are you?
I'm doing good, thank you for asking. Before we get too in-depth, we'll confirm that this is our patient with two identifiers. So I have him state his name
Quincy Banks.
and his birthday.
September 26, 2006.
Alright, good. So this is the correct patient. So Mr. Banks, I'm Samaria Mitchell. I'm a student nurse at Chamberlain University, and today I'll be performing a head-to-toe assessment on you. We just do this to make sure everything is functioning properly and that you're in good health. Will that be okay?
Yes.
It'll take no longer than 30 minutes tops. Okay? Alrighty. So, first things first, we'll assess to make sure he has no allergies.
No.
Alrighty, and then we'll assess his pain. So on a pain scale, 0 being no pain at all, 10 being the worst pain in your life, what would you rate your pain?
0.
0. Alright, so my patient's not having any pain. So we can move on with the assessment. So off general inspection, I see no signs of acute distress. His mood is pleasant. His facial expressions are appropriate for the situation. His speech is clear. And next we want to make sure that he is alert and oriented. So we'll have him state his name.
Quincy Banks.
Birthday.
September 26, 2006.
The current month that we are in.
December.
Where are we?
Home.
Yes. And then who is the current president?
Biden and Trump was with that.
Yeah. Yeah. Alright, so he knows. So I will know that my patient's in on times 4. So next we'll get closer and we'll look over his skin. So first I would note that his skin color is appropriate for his ethnicity. Then I would look anteriorly and posteriorly at his skin to make sure he shows no signs of incisions, lesions, or any wounds, which he does not. He does have small macules, but they do not raise any concern. Next, I would touch him with the back of my hands and note that his skin is warm to touch and is also smooth. So that's good. That's what we want. Next, I will move down to his nails and note that his nail beds are pink, they are round, there is no clubbing, and as well as his capillary refill is within the less than 2-second mark. So that's good, that's what we want. Next, we'll go ahead and move up to his head and his face, and I would note that his face is symmetrical, and I know that by the ends of his eyebrows, smile to the ends of his smile marks. And then I'll palpate around his head, make sure I don't feel any like lumps or bumps. And what I really want is to look within his hair, his scalp, to make sure there's no signs of lesions or infestations, which I am not seeing any sign of, so that's good. So next we'll move on to his face. Alright, so I asked him to clench his teeth. Alrighty, you can stop. And next I'm going to ask him to close his eyes, and you just tell me when you feel something. Alrighty, so that shows that cranial nerve 5 is intact. Next, I'll ask you to puff your cheeks. Alrighty, cranial nerve 7 is intact. Next, I'll ask you to rotate your head. Yep. Shoulder to shoulder. And shrug your shoulders. Alright, cranial nerve 11 is intact. Alright, so moving on closer to his face, we will assess his eyes now. So, off just looking, there's no redness, there's no discharge, signs of irritation. I have you look at me. His pupils are equal in size, they're both round and within that 4mm size. His scleras are white, look up. His conjunctiva are pink and moist, which we want. Alright, now I have you open your eyes, look at me. Alrighty, and then I have you keep your eyes on the pen. Alright, so his eyes do pass the Perla test, which means that his pupils are round, equal in size, and reactive to light as well as accommodation. Alright, ready? Alright, so keep your eyes on the pen. And now I'm doing the 6 cardinal positions to make sure that cranial nerves 3, 4, and 6 are intact, which they are because he passed the test. So that's good. Alright, I'm going to keep my pen light out. Next thing, what I'll do is move on to his ears and look and make sure there's no signs of redness, irritation, or drainage, what there's not. And next, what we'll do is do the whisper test to make sure that cranial nerve 8 is intact for my patient. So you just repeat what I whisper in your ear, okay?
Green branch. Buddy the elf.
Alright, so my patient, cranial nerve 8 is intact. Next, what we'll do is assess his nose. So just looking at it, I note that his nose is symmetrical. I have him tilt his head up, turn my pen light on and look, And note that his septum is in the center. There's no signs of asymmetry, deformity, inflammation, or drainage, which is good. That's what we want. Next, what I'll do is check to make sure my patient nostrils are patent. So I'll cover one nostril, have him take a deep breath in. Alrighty, another one. Any trouble?
No.
Alright, so my patient nostrils are patent. Next, I will take an alcohol swab and have my patient smell it. What's it smell like?
Alcohol.
Alright, so that means that my patient's cranial nerve 1 is intact. Alright, so next what we'll do is move down to his mouth. So, just looking at him, I would note that his lips are pink and moist. Take my pen light, I have a patient say ah.
Ah.
I'll note that his gums and tongue are both pink and moist, as well as his buccal mucosa. Alright, and then I have him say ah.
Ah.
The uval and soft palate do rise. Now I have you say light, tight, and dynamite.
Light, tight, dynamite.
Alrighty, so that means that my patient's cranial nerves 9, 10, and 12 are intact. So that means all his cranial nerves are intact, so that's good. And now that we're done with his upper area, we'll move down to his abdominal. So I would note that he has no accessory muscle use. His breathing is normal. He's fine. He's just breathing in and out normally. So next what we'll go ahead and do is go ahead and auscultate his lungs anteriorly and posteriorly with the diaphragm. Alright, so I have you come up. Alright, each time I put the diaphragm down, I'll just have you take a deep breath, okay?
Mm-hmm.
Alright, and so this is my patient's right side, this is his left side. Alright, so take a deep breath. Right upper lung, left upper lung, right middle lung, left lower lung, right lower lung, left lower lung, right lower lung, and left lower lung. Alright, and there are no adventitious sounds noted, just clear lung sounds bilaterally. Alright, so next, my patient's flipped. This is his right side, this is his left side. We're going to do the same thing posteriorly. Alright, take a deep breath in. Left upper lung. Right upper lung. Alright, left lower lung. Right lower lung. Left lower lung. Right lower lung. Left lower lung again. And right lower lung again. Alright, go ahead and take a seat. Alright, so my patient's lung sounds were clear bilaterally, anterior and posteriorly. So next what we'll do is move on to his cardiovascular system. So what I'll do first is palpate his carotid pulses, and I'll do them one at a time. Alrighty. Good. They're both strong and 2+. So next we'll go ahead and check my patient's JVD. So I'll have him, if we were in a hospital setting, I would have him at a 45-degree angle. I would have him turn his head to the left, and I would check this vein along his neck to make sure that it was flat, which it is in this case, so it's good. So next what we'll do is go ahead and check his edema. So, with right-sided heart failure, it shows a lot of edema, especially in the lower extremities. So I would just make sure that everything seems even bilaterally, which they do. So we're good. Alright, so after we've done that, we'll go ahead and listen to my patient's heart sounds. And we'll do this once with the diaphragm side, and then the next with the bell side. So I have you stand up again. Alrighty, and we'll do this in specific areas. And same thing, just take deep breaths, okay?
Mm-hmm.
Alright, so we have, sorry, that tickled. Alright, so we have aortic, pulmonic, herbs, tricuspid, and mitral. All right, S1 and S2 were noted. Now we're switching to the bell side, and we'll do it again. Aortic, pulmonic, herbs, tricuspid, and mitral. All right, go ahead and take a seat. S1 and S2 were noted. There were no abnormal or heart sounds or murmurs, so we're good. All right, so now we'll continue with the cardiovascular system. So what I'll do is check 3 more pulses bilaterally, left and right. So first we'll do his radial pulses. Good, and they're both strong and 2+. Next we'll do his dorsalis pedis, which is at the top of his feet. All right, strong and 2+, and then we'll do his posterior tibialis, which is in the inside of his ankle. And we'll do them both bilaterally. Good, strong and 2+. So his pulses are good and his cardiovascular system is good. So next what we'll do is assess his diaphragm. So I have him lay flat on your back. All right, so I'll check the symmetry and contour of my patient from different angles. And he does look symmetrical, and as well as his contour isn't protruding or any such thing like that, more flat, so that's good. So next what we'll do is auscultate his quadrant. So we'll start in the right lower quadrant to the right upper, and then left lower using the diaphragm. Alrighty, so starting in the right lower quadrant, right upper, left upper, left lower. Alright, and there were no abnormal bowel sounds. They were clear and normal. Alright, so next I'll go ahead and palpate, and when I'm palpating, I'll be checking for tenderness and as well as distension. So you let me know if you feel anything, okay?
Okay.
Alright, so we're starting in the right lower. Alrighty, right upper. Anything?
No.
Alrighty, left upper.
No.
Anything? And left lower. Anything?
No.
Alrighty, I did not feel any distension. My patient didn't have any tenderness, so we're good. Go ahead and sit up. Alrighty, so now that we're done with his abdomen, we'll go ahead and move on to checking the contour and symmetry of his elbows, wrists, knees, and ankles. So I'll take them and look, and we look at them and compare side by side. His elbows and wrists are good, equal in size and contour. His knees are good, and then his ankles. Yes. Good. Alright, so everything is symmetrical and as well as the contour is even bilaterally. So next we'll go ahead and check the range of motion of his elbows, his wrists, his knees, and his ankles. So I just have my patient repeat what I do. So for the elbows, flex and extend. Alright, so then for the wrist, flex, extend, flex, extend, round and round and round. Good. Alright, go ahead and lay flat on your back, and we'll go ahead and do his knees and his ankles. Alright, so we're going to flex, extend, flex, extend. Alright, point your foot towards you, and towards me, towards you, and me, round and round. Good. Alrighty, next leg. We're going to flex, extend, flex, extend. Alrighty, foot towards you, me, you, me, round and round. Good, good, good. Alright, and while I have him laying, I'm going to go ahead and check his muscle strength. So I have him pull. Yep, yep. Alrighty. Alright, pull away from me. Good, good. Alright. Now I'm going to have your leg up. And I want you to push against me. Good. Alright, let me see this one. Push against me. Good. Alright, go ahead and sit up, and we'll go ahead and check the arms out. So I have you do your hands like this, and now stand on this side. Pull against me. Good. Alright, now you pull against me. Oh, okay. Alright, so arm strength and upper extremities and lower extremities are good. So next what we'll do is I'll have my patient pull up his pants a little bit. We're going to go ahead and check to make sure he has sensation in his lower extremities. Alright, so I'm going to have you close your eyes and you let me know if you feel it sharp or dull, okay?
Sharp, dull, sharp, sharp, dull, dull, sharp, sharp.
Alright, so my patient does, you can go ahead and put your legs down, hands down, does have lower extremity sensation. So next what we'll go ahead and do is assess his gait. So I have you stand over there, and you just walk in a straight line from there to here, and again, there. Alrighty, and I'm not seeing any abnormalities. You can go ahead and take a seat. So next what we'll go ahead and do is assess our patient's pain scale again. So, Mr. Banks, on a scale of 0 being no pain at all, 10 being the worst pain in your life, what would you rate your pain?
0.
Alright, 0. So my patient still don't have any pain. That's good. We didn't hurt our patient. Next thing you do is we will go ahead and thank Mr. Banks for participating. Thank you. And in a hospital setting, if he was in the bed, we will make sure that the bed is in the lowest position, the side rails are up ×3, and as well as the call light is in reach. After that, we will perform hand hygiene, and we will be done with this assessment. Thank you guys for watching. Bye.